So the next part of the cleaning is we check for gum disease. We use a periodontal probe, and we check the patients for gum disease.
A periodontal probe, so that's like a way to measure the gums?
Yes, that is the way we use to measure the gums, and we use that along with x-rays to determine what type of cleaning the patient will need. Certain patients need different types of cleanings depending on their level of gum disease, if they have any.
So I can't just, if I'm a patient, I can't just come in and get my teeth cleaned. There might be more that's required?
Correct. Most patients do have some form of gum disease. There's about 75% of Americans that do have some form of gum disease, and at your dental visit, we will be able to determine what type of gum disease you have. There's many different levels, and at that visit, we'll be able to inform you, give you educational material, and show you how to overcome that gum disease.
But wouldn't I know if I had gum disease?
No, gum disease does not hurt. You will not know you have gum disease.
Okay, so maybe like signs of something that if I'm at home that I should be concerned about?
Well, a sign at home that you might notice is bleeding gums. That is a big one. If you notice that your gums bleed when you brush or floss, that is an indication of some form of gum disease.
Okay, so I come in and you take a look in my mouth as a patient and you say, you let me know if I have gum disease, and if I do, what type of gum disease I have.
Correct.
Should I really be concerned about gum disease? I mean, I see stuff about it on TV, but I don't know really what it's all about.
Yes, because if gum disease is left untreated, it could lead to tooth loss.
Ooh, I don't want that.
No.
Okay, so I get this gum disease treated. How do you treat gum disease? What's required?
Well, each person is different, so we make up an individualized plan for each patient. Usually, sometimes it's required of doing something called deeper cleaning, and we reevaluate your gums and the gum disease at that time. If more steps are needed, we use something called a perioprotect system in office. We also use something called Arrestin, which is an antibiotic underneath your gums. There's different techniques and tools we can use in the office to help you with the gum disease.
Okay, you mentioned this antibiotic. So is gum disease like an infection?
Yes, gum disease is an infection underneath your gums.
Oh, so I can, in other words, from what you're telling me, I can have an infection in my mouth and not even be aware of it.
Correct.
Wow, that cleaning visit sounds more important than I thought it would be.
Yeah, it's very important.
Okay, well, thank you for helping me to understand gum disease a little bit better.
You're welcome.